My name's Becky Wilson. I work as an adult speech and language therapist predominantly on the stroke unit at Kingsmill Hospital, and I also organise the student placements for the Nottinghamshire healthcare team. And I also work, because I'm based at Kingsmill, I know the specialist medicine team there as well. So one of the paid placements that I want to talk about was also at that setting.
Fabulous, thank you. So yeah, if you could tell me a bit more about that placement, that would be great.
So we had two paid placements last year. They were both from Sheffield for students at different stages of their courses. They were on some were on a master's course and some were on an undergraduate course. We had a 2-week placement where it was a 10-day placement over 2 weeks on the stroke unit, and we also had a 20-day placement over 4 weeks on the specialist medicine team. But as we're all based in the same hospital and in the same unit, we did a little bit of inter-team working to make sure that the students got like a really well-rounded placement. They worked, so each of the placements was predominantly the students working in pairs or individually managing the caseload. So definitely managing communication patients and taking case histories and planning sessions and evaluating their care, and also talking to sort of the MDT and any other kind of wider business that we have to do about managing patients rather than just face-to-face seeing them. But also from a dysphagia perspective, we were allowing them to hone their skills in that as much as possible. They won't be able to do that independently because they weren't signed off from that, but we were helping to support their dysphagia management skills as well. And with each of them, we had created a timetable, so they had opportunities to shadow OTs and physios, other members of the MDT, particularly on the stroke unit, and they also attended multidisciplinary team meetings and handovers, for example, in the morning. We also run a video fluoroscopy clinic every Wednesday, which is great for students to be able to attend. So every student had an opportunity to attend that clinic. And again, they did that on an individual basis, but it therefore meant that they could have time to do things independently as well as just doing things as a pair.
Fab. Can you tell me a little bit about what worked well, kind of setting the placement up in that way?
Yeah, I think it works great because there's less impact on the therapist, to be honest. The therapist has got definitely more free time, even in a busy hospital like we have. It's a 500-bed hospital. There's time for the students to even just learn to navigate around, because there's 2 of them. I'm quite confident leaving them to get a little bit lost on the first day if they have to, and they're able to, if they need to go to a certain department to get the parking sorted, for example, even just with setting up the placement, they're able to go and do that without me necessarily hand-holding them as much as I did. And I feel also for their learning, it meant that as a pair, they were able to problem solve within sessions a lot more than they did before. So if I'd had somebody independently, that was a little bit more of an onus on me to be able to help them to reflect on the session and see how they might even plan the next session or what they might do. But having 2 of them to be able to discuss that together, I felt it really encouraged. Fortunately, we had students that worked well together and did benefit from this, and I realised that there's different student relationships and rapports, but in these 2 paired placements, that's worked very well.
Is there anything that you feel you kind of wish you'd known before kind of setting out offering the pair placement?
No, we feel quite comfortable with the peer placements as they went. This year we have started doing COVID risk assessments, and obviously in the last sort of 18 months for students before they've come, and due to sort of more virtual technology, we've been able to do that online, so just meeting someone for half an hour and doing the COVID risk assessment, but also giving them the opportunity to ask any additional questions they might have around placements, which means that the students just had a better realise of expectations.
Wonderful. And finally, have you got kind of a top tip or just one piece of advice if someone was thinking of setting up a paired placement?
I think don't be daunted by it. I definitely think it's a brilliant opportunity. I'm not having individual placements again after I've had paired, definitely not. But I think you definitely need to set aside a bit of planning time and even some contingency activities, because having 2 people staring at you asking what to do when you've got a bit of a mind blank can be quite daunting. So it's nice to have a bit of a bank ready. But I think across our wider team, enough of us have had peer placements that we've got together a bit of a resource ideas that we've all got on the shared area to have a look at. So there usually is something that I can find for them to do.
Brilliant. That's great. Thank you so much. And yeah, I think
Okay.
it's really, really, just really valuable for people to hear about that, because I know when I've spoken to people about having more than one student before, they've gone, oh, twice the work. But actually, what you said about actually reducing workload, I can totally relate to that, because I think, like you said, just them being able to problem solve together, and sometimes things get to you before they've sorted it out, and it's
definitely.
Thank you.